Hello, I am Dr. Leong. Today I shall be talking on breathing well. If we are not breathing well, we shall be experiencing breathlessness. These are the topics which we shall be discussing and how they can help improve our breathing. Respiratory system, nutrition, exercise, sleep, relaxation, hobbies and leisure, smoking cessation, overcoming air pollution, and spirituality. Breathlessness is commonly referred to as shortness of breath. Shortness of breath can occur at rest, meaning to say the disease, whether affecting heart or lung, is quite severe, or in relation to exercise like walking, running, or climbing stairs. Shortness of breath can also be related to posture. For example, shortness of breath occurring while lying flat on the bed, like in heart failure or kidney failure, due to fluid congestion in the lungs. Shortness of breath can also occur suddenly, like in an acute heart attack, or slowly, like in COPD, chronic obstructive pulmonary disease, or lung fibrosis. There are many causes of breathlessness. Breathlessness can arise from diseases of the upper airways, like in obstructive sleep apnea, diseases in the lung like asthma, COPD, interstitial lung disease, diseases of the heart like coronary artery disease, diseases of the heart valves or heart muscles, diseases of the kidneys like in diabetes mellitus, diseases of the liver. It can also arise from the mind, like in anxiety and depression. A lack of exercise results in effort intolerance, causing breathlessness while exercising at low workloads. The respiratory center is located at the pons and the medulla, which are parts of the hindbrain. The main muscles of respiration is the diaphragm. Other muscles of respiration include the intercostal muscles and the accessory muscles of respiration. The chemoreceptors sense changes in blood oxygen, carbon dioxide, and acidity, and give feedback to the respiratory center. These chemoreceptors are found peripherally in the blood vessels and centrally in the brain. There are also receptors in the muscles, joints, and lungs, which give feedback to the respiratory center. The respiratory center controls respiration in terms of rhythm, rate, and depth of breathing. A person while resting normally breathes at the rate of 12 to 16 breaths per minute. A person can also control the rate and depth of breathing voluntarily. To be able to breathe well, one must have an intact respiratory center with a normal receptor function. Taking in a breath or inspiration is an active process involving the diaphragm and intercostal muscles. The accessory muscles are used to improve lung ventilation whenever there is insufficient blood oxygen to meet bodily needs. Breathing out or expiration is a passive process and is dependent on lung recoil. The abdominal muscles are used mainly to push air out, like during huffing or coughing. To be able to breathe well, one must have strong muscles of respiration. This diagram shows the muscles of respiration. The diaphragm is the main muscle of inspiration. The diaphragm is pulled down when it contracts, and this action sucks air into the lungs. The external intercostal muscles lift up the ribs and further increase the negative pleural pressure, which helps air flow into the lungs. The accessory muscles of inspiration include the scalene, sternocleidomastoid, trapezius, and pectoralis major muscles. These muscles are seen in action around the shoulders, neck, and upper chest. When they contract, the accessory muscles of inspiration lift up the breastbone, upper ribs, and collarbones. This causes the upper part of the chest to rise, making the lungs bigger and allowing more air to enter. When the person is not having enough oxygen, the body automatically activates these muscles every time the person breathes in. Expiration is a passive process. However, during forced expiration, the abdominal muscles like the rectus abdominis, transverse abdominis, and internal and external obliques, and the internal intercostal muscles play a role in forcing air out. Diaphragmatic breathing increases the excursion of the diaphragm, improves the ventilation of the lungs, decreases the work of breathing, improves gas exchange, and hence oxygenation. It is practiced during breathing control, where inspiration is relaxed, slow, and deep. During diaphragmatic breathing, the diaphragm contracts and flattens out, and the lungs expand. As the abdominal content moves down and out, a hand placed over the tummy will be pushed outwards. During inspiration, air flows along the upper and lower airways to the alveoli, where gas exchange occurs. The upper airways include the nose, pharynx, and larynx. The lower airways include the trachea and the bronchial tree. To be able to breathe well, one must have normal airways. The lungs contain many different types of cells. Most cells in the lung are epithelial cells lining the airways. Goblet cells make mucus which lubricates and protects the lung by trapping air particles, bacteria, viruses which enter the lungs during breathing. Cilia in epithelial cells form the mucociliary escalator, which sweeps the trapped particles up the airways to be swallowed or coughed out. There are about 300 million alveoli in the lungs, which when laid out flat is about the size of a tennis court. Here in this diagram, you see the alveolus containing the air. This is the blood vessel, and in between them the interstitium. Gas exchange occurs between contents of the blood, namely the red blood cells, and air in the alveoli. Oxygen from the air sacs diffuses into the blood, whereas carbon dioxide from the blood diffuses into the alveolus. The type 1 pneumocytes cover 95% of each alveolus and are ideal for gas exchange. Alveolar macrophages are the primary immune cells, clearing the air spaces of infectious, toxic, or allergic particles by secreting a wide variety of destructive chemicals and by recruiting other white blood cells to mount an inflammatory response. Other cells in the lungs include red and white blood cells, interstitial cells, which form the supporting matrix. Proper nutrition is important to strengthen the body's immune system and breathing muscle strength. Nutrition may need to be increased in amount to counter weight loss from poor appetite, increase in breathing workload, and frequent infections in various lung diseases. Nutrition should be well balanced. This is the food pyramid. It is important to include the right portions of fruits and vegetables every day. Meat and milk products should be included in the diet. Fat, oils and sugar should be taken sparingly. Some nutritional supplements may be considered, like antioxidants, vitamins, minerals, etc. Exercise is important for health and general well-being. Exercises can be divided broadly into exercises which improve flexibility, endurance, or strength. Various aerobic exercises like walking, climbing, running, swimming are excellent. The exercises should be of sufficient intensity and duration to improve health. Some factors to consider before exercise are like before meals, temperature, pollen count, atmospheric pollution, and the intensity of UV light in the outdoors. There should be some form of goal setting and monitoring in your exercise program. Walking is an excellent form of exercise. Try to be active by accomplishing at least 10,000 steps or more per day. The intensity of exercise can be set according to target heart rate or degree of breathlessness. The maximal heart rate during exercise can be calculated. It is 220 minus age. The target heart rate during exercise should then be about 70 to 80% of maximal heart rate. This target heart rate should be maintained for about 20 to 30 minutes to obtain maximum benefit from the aerobic exercise. For people with lung diseases, shortness of breath will be a limiting factor on the duration of exercise. The modified Borg breathlessness scale of 3 to 4 should be the exercise target. This is when a person is feeling breathless, but yet able to speak a few words in a sentence with short breaks in between. Remember to sleep well. There should be a total of 6 to 7 hours of sleep per day, including naps during the day. Practice good sleep hygiene with a cool and silent bedroom, comfortable bed and proper lighting. The bedroom should be dedicated for sleep only and must not have a TV or workstation to disturb the sleep rhythm. A person who sleeps with loud snoring may have obstructive sleep apnea. Obstructive sleep apnea causes restless sleep. It can be easily diagnosed by requesting for a sleep study. Stress brings on the fight or flight response. Our state of mind influences our breathing pattern. Anxiety can increase the depth and rate of breathing, making a person feel breathless. A claustrophobic person experiences breathlessness when he enters a lift. During a panic attack, the person hyperventilates, feels faint, experiences muscle cramps, and numbness around the mouth. Conversely, if we focus on our breath, breathing slowly and deeply, we can evoke a relaxation response in our body. Relaxation of mind and body will improve general well-being. Some well-known methods to induce relaxation are progressive muscle relaxation. This is a technique which involves tensing and then relaxing muscle groups, one by one, from head to toe. This helps you release physical tension, which may ease stress and anxiety. Mental health can be enhanced by paying more attention to the here and now, including one's own thoughts and feelings, and the world around. This awareness is sometimes referred to as mindfulness. Repetitive prayer is about silently repeating a short prayer or phrase from a prayer while practicing breath focus. Guided imagery is a relaxation technique that involves visualizing positive, peaceful settings like a beautiful beach or a peaceful meadow. Good hobbies include painting, gardening, and keeping pets like fish, dogs, and cats. Leisurely field trips and travel are great for unwinding after long periods of work. To be able to breathe better, quit smoking. Smoking can cause chronic bronchitis, emphysema, COPD, and lung cancer. It can be a trigger for asthma attack as well. The main cause of air pollution is the burning of fossil fuels. Harmful gases like sulfur dioxide, carbon monoxide are released into the atmosphere due to incomplete combustion of fossil fuels, which pollutes the air. Other causes of air pollution include industrial emissions, wildfires, open burning of garbage, construction and demolition, and microbial decaying processes. Air Pollutant Index (API) is an indicator for the air quality status at any particular area. The API value is calculated based on the average concentration of air pollutants, namely sulfur dioxide, nitrogen dioxide, carbon monoxide, ozone, PM 2.5, and PM 10, PM standing for particulate matter. The air pollutant with the highest concentration, dominant pollutant, will determine the API value. Normally, concentration of particulate matter 2.5 is the highest among the other pollutants and determine the API value. Here in this chart, you can see when the API is above 100, the air is unhealthy. When the API is above 300, the air is hazardous. Protect yourself by limiting the time spent outdoors when the air pollutant index is high. You may wish to stay indoors with windows closed. The N95 mask can effectively limit the pollutants suspended in the air. The N95 mask carries a 95% filtration rate of particles larger than 0.3 microns in size. The N95 will filter off most of the PM 2.5 particles, which are 2.5 micron in size. Indoor air pollution. Environmental tobacco smoke causes health problems just as much as a person who smokes. An improperly adjusted gas stove can emit more carbon monoxide than one that is properly adjusted. A blue-colored gas flame has the right amount of gas and air mixture. Building materials and furnishings can release pollutants more or less continuously. Certain cleaning compounds, personal care products, and hobbies like woodworking also release pollutants. Biological pollutants include molds, house dust mites, bacteria, and viruses. Improving indoor air quality. Usually, the most effective way to improve indoor air quality is to eliminate individual sources of pollution or to reduce their emissions. Another approach to lowering the concentration of air pollutants indoor is to increase the amount of outdoor air coming indoors, that is, by opening windows and doors. The effectiveness of an air cleaner depends on how well it collects pollutants from indoor air, expressed as a percentage efficiency rate, and how much air it draws through the cleaning or filtering element, expressed in cubic feet per minute. An air cleaner with a HEPA filter, HEPA filter, or high efficiency particulate air filter will remove at least 99.97% of dust, pollen, mold, bacteria, and any airborne particles with size of 0.3 micron. Yes, we have talked about improving breathing, mentally and physically. There's also this spiritual aspect of health. Well, no matter how we keep healthy, life will end one day. The average life expectancy of Malaysians is now about 75.6 years. Being spiritual is acknowledging the existence of a spiritual realm and the presence of God. There are several religions in the world. With Christianity, there is hope for an everlasting life centered on the belief in Christ and His saving grace. Thank you for listening. I hope you have discovered some new facts on how to improve your lung health. Thank you once again.